The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers and do not represent an offer to buy or sell any securities. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
This is Bob Roth, Health Futures, taking stock in you. Welcome to our show, and welcome today. I have a good friend and a great guest by the name of Maryglenn Boals. Maryglenn Boals is going to be joining us today to talk to us about long-term care, specifically long-term care insurance. Her company, MgBoals Associates, is an independent insurance agency specializing in long-term care planning and insurance products. Maryglenn brings over 25 years of experience in the healthcare field to her long-term care planning. She blends her expertise from the long-term care facilities, hospitals, and insurance plans to her agency in helping her and assisting her with the planning process. She speaks at local and national conferences to increase the understanding regarding long-term care planning and benefit maximization. Maryglenn is recognized by the American Association of Long-Term Care Sales as one of the top sales representatives in the country. You know, Maryglenn brings to us those 25 years of healthcare experience because what you've told me before, Maryglenn, is that you wanted to make a difference. A lot of these people that were coming into the communities that you were overseeing were coming in with inadequate planning, inadequate resources, and you felt like there was nothing you could do to help them because they were there. They got to that point, but they weren't able to afford or maximize that long-term care planning process. So tell us a little bit about why you got into this.
Well, thank you so much for having me, Bob. I really appreciate being here. And as I've shared with you, I was a former nursing home administrator out here in Arizona, and I just saw what was happening to families when you're making some very difficult decisions, and they're all based on finances when their loved one was in our facility, and then the money was either running out or had run out, and maybe our facility didn't have the appropriate level of care for them that would accept Medicaid, which is our all-tex here in Arizona. And so I thought, I want to get ahead of this problem. And part of being able to do that is to have the conversation with people. I always say, I'm going to talk to you from the other side of the desk now. I've sat on that other side of the desk as an administrator in a building. I want you to understand what the differences in these different payment plans might mean when you come into a facility.
That's incredible. I mean, it really is, because let's face it, one of the things that we're finding out with this silver tsunami is people aren't ready. They're buying insurance, and this is what I'm hearing, Maryglenn. They're buying health insurance. Affordable Care Act. Now they have to buy health insurance. They're buying homeowners insurance. They're buying automobile insurance. And they're buying life insurance. But what's amazing, and there was a statistic that I shared with you. I went back to my archives, and I sent this to you a couple years ago.
I remember that.
and it's interesting because I want to give our listeners some statistics. The odds of your home having a fire is 1 in 1,200. The odds of your automobile being total is 5 in 1,200. The odds of you being hospitalized is 105 in 1,200. And the odds of needing long-term care, 720 in 1,200.
It's a very common statistic, Bob, that 70% of people over age 65 will need long-term care. But I think that's something we need to explain. what is long-term care? Because a lot of people think it's a place. They think that's a nursing home, which is kind of my arena where I came from, but it's really more about an event. I think we have to kind of define long-term care a little bit here for your listener.
I would love for you to do that. That would be great. And I want to just expound on one thing. You talk about an event. It is interesting because we, as people in our community, we think of events as concerts, sporting events. But in the medical profession, when a doctor says you've had an event, it's not a good thing.
That's not a good thing.
It's not a good thing. So expound a little bit about the event and long-term care.
Now, I'm going to kind of frame it in how the insurance world also sees this type of event. When we talk about long-term care and long-term care insurance, it's really saying when something happens to you, and we don't define what that might be. When something happens to you, it could be aging, could be an accident, it could be some type of other illness. It doesn't always mean when you're old. But what they look at is you're now unable to do some of your activities of daily living. Now, activities of daily living are those things that you do as soon as you wake up in the morning. I say as soon as your eyes pop open, you're going to get out of your bed, transfer out of that bed, hopefully walk yourself to the restroom. You might make your breakfast. You're going to get dressed. All those things. Activities of daily living are eating, dressing, bathing, toileting, transferring, and continence. So the type of event that would cause you to be unable to do 2 of those 6 things that I just listed, that's considered a long-term care event. Those are physical things that could happen. The next is really about cognition. Now we have a cognitive event happen, and that means that you're unable to care for yourself. And that could be anything ranging from Alzheimer's to a head injury to Parkinson's or a stroke, where the impairment has been more at a cognitive level, not a physical level. So in the world of long-term care insurance, when they talk about, being able to have this event and pay for the care, they're really referring to that 2 of 6 activities of daily living loss or cognitive loss, and we anticipate it to last longer than 90 days. That's why it's called long-term care. They could just as easily call it extended care, because that's really what they're talking about. So we have to get our heads around that it's about an event, because where you receive long-term care is kind of up to you. People can choose home care, which is what you do. They might choose assisted living. They might choose to go to adult daycare, or maybe they do go to a skilled nursing facility. There's a lot more choice than people realize.
And what's interesting is a lot of people think of the latter choices versus home care. And a lot of the long-term care policies that were written back in the 1980s made provisions for assisted living, skilled nursing, but nothing for home care.
Well, and you also see some that had for home care, had for nursing home, but they didn't do assisted living, because assisted living, as you and I know, we've been in this long enough, we saw those evolve in like the 1980s.
Right.
So it kind of went both ends of the spectrum. Now we have a real full continuum and people have lots of choices. The big thing is, do you have the finances to pay for all those choices?
Great point. And I really love the description you gave about the activities of daily living. And I hope our listeners can visualize when you get up in the morning and all the activities that you do. And the cognitive descriptions are spot on, too. And, long-term care is something that nobody really wants to talk about. Nobody really thinks about. It's not sexy. I mean, we all know we're aging, and this silver tsunami is upon us.
It's the silent concern. That's actually a term that I've heard used, because I don't want to talk about it with my children if I'm, getting older. This is uncomfortable. Maybe the kids don't want to bring it up because they don't want to question the parents' health status. So everybody's worried about this, but nobody's talking about it.
Nobody's talking about it. Nobody's buying insurance. And that's the crazy thing.
We insure our cars, we insure our houses, but we're not insuring our lives with that health care. Exactly.
And so many people are the mindset that I don't need to do this. I think that the government will take care of me. through some of the programs that they have, like Medicare. And that's a great segue for us to take a pause right now and come back, and we'll pick up on how to really pay for long-term care insurance so that we can protect ourselves for the future. This is Bob Roth, and I'm here with my guest, Maryglenn Boals, Health Futures, Taking Stock in You. We'll be right back.
Change is good, but sometimes it's great. Like SCF Arizona becoming Copper Point Mutual. It's a change fueled by a desire to find better ways to protect Arizona businesses and their employees. While the name may change, you can still expect Copper Point to be a caring and financially strong partner. So if you're looking for a workers' compensation expert, get to the point. Copper Point Mutual, an AM Best A- rated company.
Need $10,000 or more in cash? No bank to work with? No worries. Biltmore Loan is here to provide immediate cash for your assets. Diamonds, jewelry, watches, art, cars, RVs, even land. And more can be quickly converted into the money you need. All negotiations are confidential and conducted in an upscale office building in Scottsdale. To make an appointment, go to BiltmoreLoan.com or give them a call at 480-991-LOAN. That number again is 480-991-LOAN.
When I grow up, I want to be a new pair of blue jeans.
When I grow up, I want to be a kid's first computer.
When I grow up, I don't want to be a piece of garbage. And if you recycle me, I won't be.
Give your garbage another life. Recycle. Learn how at iwanttoberecycled.org. Brought to you by Keep America Beautiful and the Ad Council.
If you are wondering how you are going to create, preserve, and maintain your financial security when facing an uncertain future, including increased taxation, inflation, unpredictable market returns, and longer life, then this event is a must for you. You cannot risk missing out on this vital information. Nancy Fleming and Fleming Financial Services want you to know these 5 vital topics: guaranteed retirement paychecks, inflation protection, future health care expenses, your IRA strategy, and safe havens for market volatility. Enjoy more financial certainty in an uncertain economic and financial environment, and attend Fleming Financial's upcoming workshop this Tuesday, January 28th at Kokopelli Golf Club in Gold Canyon. Space is limited, so reserve your seat today. Call 480-632-8770. 480-632-8770. That's 480-632-8770, or visit FlemingFinancialServices.com.
It's the 10th anniversary of the Woman Entrepreneur Small Business Boot Camp. Register online at www.womensbusinessbootcamp.com today.
Money for now, money for later, money for your heirs. The things you're concerned about, we talk about and offer great advice. We're Money Radio 1510 and 99.3 FM. Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. It's Bob Roth, Health Futures, taking stock in you, and I've got our guest, Maryglenn Boals, here with us. Before we start talking about how to pay for this, I'd like to make sure our listeners know how to reach you. I look at you, just so you know, as really an expert in long-term care. And Maryglenn, you know this. Whenever one of my clients has a challenge or is interested in talking about long-term care, friend or colleague or an associate or somebody I know in the community that's interested in long-term care, not necessarily just insurance, but long-term care, I have them contact you. So I want our listeners to know how to reach you. So if you need to reach Maryglenn Boals, she is the president and founder of MgBoals Associates, and she can be reached at phone number 602-418-5069. You can also go to her website, www.mgboals, and that's BOALS.com. Or you can reach her at MgBoals, BOALS is how you spell Bowles, at MgBoals.com. So, Maryglenn, This is a great opportunity to talk about how to pay for this, because this is changing literally by the day. I bought my first policy 10 years ago, and that policy, anything even close to what that's like, is not here anymore. So I want you to talk a little bit about the evolution of this, because it is changing. And a lot of it has to do with the fact that this tsunami is upon us. And I think, and I may be wrong on this, I think the insurance companies were looking at long-term care insurance more like life insurance. And they were expecting people to let policies lapse. And those people out there that own long-term care insurance realize that they have a diamond in the rough in their possession. And they realize once they have it, I can't let this thing lapse, because this is going to save me and certainly my family a lot economically as well as emotionally. So please, if you would, expound on that for us.
Sure, Bob, and you hit on such a great point. The people that came up with the whole concept of let's insure this risk of long-term care figured that it would behave like life insurance and that people would have it for a while and then kind of give up on it. Well, as they were getting older and older, this became much more valuable to them, personally, emotionally, and financially. So the rate that people let this insurance go is less than 1%. So it's very, very low. It's a very unusual product. We buy this, and it could be 20 to 30 years before you ever use it. You buy this product, but you may not be the one actually working with it. It may be your adult children. It may be someone else needs to, actually utilize the policy for you. So it's got this really long lag time between purchase and utilization. So many times you're dealing with, here's the policy I bought. The adult children weren't even in on the conversation. So we also, at our agency, we provide a service to help people who are sitting there with a policy going, okay, my mom and dad need care now, and I have no idea what this thing will do. So we kind of call it LTC coaching, where we actually go through, review the policy, tell you what you've got, what's the best way to utilize it, and how to get that to pay. So we do that for a fee. But, otherwise you've got this great funding source, this great contract, but if you're not a person who understands some of this language, you're not able to tap into those funds.
And to that point, I've called on your assistance for many of our clients because many of them don't know what they have. And you know what? There's a lot of legalese in these agreements. And I, for one, was able to buy another additional policy through you, and you helped me understand that. But then again, it was me that understood that.
Well, and how many people would think, how can it make sense to have two long-term care policies? One, both of us actually do. But we've been in these fields for a really long time, and we know personal situations and why it makes sense in our life. And I think that's the biggest thing about buying this. People can be more in control of this conversation than they realize. They call me up and they just are like, I want a quote. Well, what do you want a quote for? We have to talk about what's your budget, what are you trying to insure, how much do you need. Everybody is so different. This is a really unique product, and it's got such a huge educational curve that people need to understand it before they say yes or no to it. And I think that's really important for people to understand.
Educational curve is huge. I never knew what elimination days are. And I got to tell you, I don't think many of our listeners even know that. And it's amazing how I have clients that have policies, and I ask them what their elimination days are. They don't know.
So you have to think of elimination days just like your car insurance has a deductible. And you might select $200, $500, $1,000. In long-term care, it's expressed in how many days are you willing to pay before your policy before the carrier has to pay. So you might pick 30, 60, 90, 100. You can have options clear up to 180 to 360. I don't really recommend those. Even 90 days sometimes can be a very long period. And that's one of the things that people misunderstand is they go, well, but doesn't Medicare pay for those first 90 days? I mean, that's a subject, I'm sure you hear that all the time. People think Medicare is going to pay for this. The 90 days and the Medicare thing, all the planets have to align. You have to dot all your I's, cross all your T's, and maybe, because the way the Medicare's rules work is that if you're hospitalized and you have 3 overnights, and I'm going to give this a very brief overview. It's not going to be very technical, but on the simplest terms, we have 3 overnights. We're staying in the hospital, and we were admitted. You can't just be on observation bed. And then we're discharged to a care facility for the same reasons that we came into the hospital. After that, we would have 20 days that Medicare fully would pay for any skilled nursing facility. Day 21 to 100, you have the possibility of getting more coverage, but you will have a coinsurance. And currently, that's $152 out of your own pocket. Then Medicare puts some more money with that.
Is that $152 total, or is that per day?
Per day.
Per day.
Per day.
Wow.
And so Medicare is putting more with that, but it's $152 a day. So that's still not cheap. The part in that, any point in that 100 days, you have to be recuperating, restoring, rehabilitating. You have to be improving and increasing. And what happens is at some point people plateau. And that's kind of where Cypress HomeCare, all these other facilities and agencies get involved, because when you become what the word is custodial, it's more you need help with just those activities of daily living. I maybe don't need medicine. I don't need you to do anything really technical in nursing. I just need help with my basic activities. So that's where people don't understand that at any point Medicare could stop paying.
And they do.
And they do.
And they become very surprised when they come and talk to us and say, so how much is Medicare going to contribute to this? And I have to tell them nothing.
Well, my father just was in the hospital for 10 days this past summer, and then he was discharged and he had home care nursing. Well, the home care nurse came about every 3rd or 4th day, took his blood pressure, kind of checked on him, a few little nice things like that. But this wasn't anyone to help him in and out of a shower, make sure his meals were maybe taken. Is he taking all his medication properly at the right times? Very different what Medicare is concerned about in terms of nursing versus this custodial level, home care, private duty, all those kind of terms that we're talking about.
And it's interesting with the Affordable Care Act. A lot of people think that the Affordable Care Act is going to pay for this. And as a byproduct of the Affordable Care Act, and I've talked about this on my previous show, these accountable care organizations have all been created. But there's no provision for home care. And just to your point, a home health person comes in that case, once every 3rd or 4th day. Some may come in every other day, but they come in for what they call episodic events. And that is therapeutic, that is wound care, that is, giving medications. But they're gone after 45 minutes to an hour and a half. Then what happens? How do we prevent these readmissions? I am learning so much from you, and I'm hoping our audience is as well. And I'm being told now we've got to take another break for our sponsors. But Maryglenn, I look forward to having you back. We're going to take a break now. This is Bob Roth, Health Futures, Taking Stock in You. We'll be back in a minute.
Now, a break for an update on the latest news from around the world on NBC from Money Radio 1510 and 99.3 FM.
NBC News Radio, I'm Luke Russert. It's day 2 of a sell-off on Wall Street. The Dow down as much as 200 points in early afternoon trading. On CNBC, Art Cashin with UBS Financial Services said the downturn is due to a variety of global concerns.
Yesterday was 70% China. Today it's 80% emerging markets and currencies.
In Cairo, Egypt, at least 6 people are dead following a string of bombings hitting the central core of Egypt's government. NBC foreign correspondent Ayman Mohadeen.
Today's attacks were extremely symbolic because they happened on the 3rd anniversary of the January 25th revolution. More importantly, they happened in the heart of Cairo, targeting buildings that were supposed to be very heavily guarded. So they carry not only a strategic and tactical significance, but also symbolic.
And a jury in Texas has sentenced former Dallas Cowboys player Josh Brent to 180 days in jail and 10 years of probation for a drunk driving crash that killed his teammate Jerry Brown. This is NBC News Radio.
Are you paying too much for term life insurance? There's a tremendous price war among the major term life companies, and rates have dropped dramatically in the past few years. For example, for a man age 45 non-tobacco user, it's $1 million of coverage and $75 per month level rate for the next 10 years. Or a man age 50 non-tobacco user can obtain $500,000 of coverage for a monthly premium of only $110 per month, guaranteed not to change for the next 20 years. That's right, level rate guaranteed not to change for the next 20 years. If you're a smoker, we have great rates available for you as well. At Term Busters, we specialize in policies of $500,000 and above. If you're looking for new or replacement term life insurance, call today for a quote at 1-800-862-8376. That's 1-800-862-8376. You're probably paying more than you should. Call Term Busters at 1-800-862-8376 or visit our website at termbusters.net. Remember, 1-800-862-8376. Rates and availability may vary by state. Sample rate quotes based on preferred non-tobacco underwriting. Exam required to qualify.
I need a data backup solution for my business to replace my current tape backup device.
Do you want to spend a lot of money?
No.
Do you want to store and pay for replicated data?
No.
How about a solution that's difficult to install and use?
No.
Offshore or automated phone tree support okay?
No.
Then yes, we can help.
Barracuda Backup. End-to-end protection for physical and virtual servers, including data deduplication to significantly reduce storage requirements, and replicated cloud storage for assured recovery, and live humans to answer your calls. Try Barracuda Backup free. Go to barracuda.com/yes.
How do you know the used car you're getting is good? One you can really trust? Well, start with KBB.com's most trusted car brand, backed by an extensive limited warranty, and you've got yourself a certified pre-owned Honda. So get going while the getting is good. Find the one that's right for you at HondaCertified.com. See your Honda dealer for limited warranty details. Based on 2013 Brand Image Awards from Kelley Blue Book. Visit KBB.com for information.
The Best After 50 Expo in the West Valley is coming soon. The Walgreens Love and Life After 50 Senior Expo includes over 60 exhibitors in a fun and informational day, Tuesday, January 21st at the Sundial Recreation Center, Sun City. If you're over 50, this is a premier event you don't want to miss. The day's events and parking are free and include entertainment by the popular chauffeurs. Hourly drawings for door prizes include $100 cash at 10, 11, 12, and 1 p.m. So come join in on the fun at this year's Walgreens Love and Life After 50 Senior Expo, January 21st from 9 a.m. to 2 p.m. at the Sundial Recreation Center, 14801 North 103rd Avenue, Sun City. Sponsors include Walgreens, Travel Assurance Promise, Health South Valley of the Sun Rehabilitation Hospital, Scan Health Plan Arizona, and Sun Health Senior Living. For more information, go to loveandlife.com. That's LOVINLIFE.com and click on Expo.
If you're nearing retirement or already retired and you're considering an annuity in the next 30 to 60 days, I have a caution for you. Don't buy any annuity until you understand which kind of annuity best fits your needs. Specifically, which annuities provide the most liquidity, which have the lowest cost, and which can provide you with the most income. MyAnnuityGuy.com is America's best and your local resource for honest, ethical, and complete answers to your annuity questions. With no cost or obligation, we'll help you arrive at a sound, profitable, and safe annuity decision. Our system monitors more than 1,200 annuities. Why? Because you don't just want any annuity. You want the best annuity for you.
This is Steve Jurich. Finally, learn which annuities pay the most, cost the least, protect your heirs, and protect your principal. See my GPS system in action. Call me at 888-310-1776, 888-310-1776, and visit myannuityguy.com.
Bosch is the quietest dishwasher brand in the U.S. and now features a third rack. See it at Spencer's TV and Appliance today.
People care about Care.com. This is the Dow Jones Money Report. I'm Jen Ursulo. Care.com shares are soaring 41% in their market debut. The company runs an online service to help people find and manage family care. It raised $91 million, pricing its offering at $17 per share, above an expected range of $14 to $16. Stocks keep pummeling, joining a two-day sell-off in global equities as continued volatility in emerging markets prompted investors to flee riskier assets. The Dow Jones Industrials are plunging 256 points to 15,940. The Nasdaq sinking 78 points. The S&P 500 tumbling 30. Procter & Gamble's second quarter net income fell 16% as the world's largest consumer products maker faced tough competition with year-ago results and nearly flat global sales. But its adjusted earnings beat Wall Street expectations. Shares are up 2%. Again, the Dow is down 251 points. I'm Jen Ursillo, Dow Jones Money Report.
Look, the worst part about business travel is worrying about my wife and kids at home alone. My family's safety is my responsibility. That's why I started researching home security. I called the big alarm companies, checked online, even looked at doing it myself. But the best technology for the best price came from Vivint. They even won the Consumer's Digest Best Buy Award. Yes, Vivint gives me a complete security system, but it does even more. Vivint's video technology is unreal. I can see what's going on in my home right from my smartphone, tablet, or computer. I can even lock the doors remotely if my kids forget. Best yet, I got Vivint's no equipment costs and free install deal. $1,300 worth of camera and security equipment at no charge. Vivint was the easy choice for my family's safety.
Take control of your family's safety with Vivint. Order now for up to $1,300 in security equipment at no charge. Just pay as little as $99 for activation. Plus, call now and installation is free. Call 1-800-789-3239. That's 1-800-789-3239. 1-800-789-3239.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Good afternoon. This is Bob Roth with Health Futures, taking stock in you, and I'm here with our guest, Maryglenn Boals, who is our expert on today, talking about long-term care and long-term care insurance. When we last left, we were talking about how do we pay for long-term care insurance, and there's just so much misinformation out there. And we're going to try to give our audience just a better understanding of how do we pay for it, how do we prepare for it, and what do we do about it.
I think some people may even be surprised, Bob, to learn that they have money that could easily be transferred into other types of vehicles that could help them pay for long-term care. They may be sitting on it right now and not even have any out-of-pocket expense. Let's just kind of go through the different ones. We have traditional long-term care insurance. Usually you just pay a payment every month, every year, whatever that might be. And when you go to need this type of insurance, you would get reimbursed for your expenses. So that's very traditional in how you would buy it. It usually has a lower premium, kind of a lower cost of entry. So that becomes pretty common for a lot of folks. Another type is a life insurance policy with a long-term care rider. Now, that's different than if you have a chronic care rider or you're going to do some type of life settlement. And you have to read those very carefully because you could have tax consequences. The only thing I would say with a life insurance / long-term care is anytime you do this combination of products, sometimes you get a little dilution. It may not be the very best life. It may not be the very best long-term care, but you're trying to solve a problem. And if that means we can take some cash value that we already have in whole life insurance, then it works, because maybe going back out to that traditional doesn't make so much sense. You have to really look at everyone's different situation. You also now are able to take cash value in life insurance and convert it into an annuity with a long-term care rider. Both of these, you can do those transfers via what's called a 1035 exchange. I always just say it just means that money never sees daylight, it never reaches air, so you don't have any tax consequence. It's just kind of done behind the scenes, and very simply, I worked with a couple and they moved about $200,000 worth of cash value in life insurance over into an annuity and created, really nice pools of money for long-term care. The life insurance had served them very well during their years as owning a business. They needed that. But then now, without any expense out of their own pocket, they were able to slide right over and create long-term care protection now that they were both over 65. So it made a lot of sense. There's a lot of different ways to do this. Because if you aren't working with a product of some sort, the only other ways to pay for long-term care are really out of your own pockets. And if you qualify, and that means qualifying financially, medically, and otherwise for any kind of All-Tex or the state's Medicaid program, because as we talked about earlier, Medicare doesn't really cover much of this. And I always caution people that say, well, I think I'd have VA coverage. You need to look into it now. I know that system moves very slowly for folks, so I always just tell people, look into it quickly.
I want to just bring out to our listeners some facts and figures that kind of, support what you're saying here. And, first of all, I think we're playing roulette if we expect our children to take care of us, because we don't know what the future holds, and we don't know what position they're going to be in.
And some of those kids may want to buy you the long-term care insurance policy because they may not really want to take care of you if they knew that that was your expectation.
Exactly. But when you're really looking at care, when you're looking at home care, the services that we provide, you're looking at, anywhere paying on a dollar amount as low as $15 or $16 an hour up to $28 or $30 an hour. And if you're looking at, 5 hours a day for multiple times a week, you're looking at expending somewhere between $40,000 and $50,000 a year. And if you're looking at assisted living, you're looking at a range of around $40,000 a year. And that isn't, certainly going to be the Taj Mahal. It's going to be the very fundamental basics, because the higher end ones are going to command $50,000 or $60,000 a year. But you're looking at nursing homes, you're looking at anywhere from, let's call it high 60s to almost $90,000 a year. And the question is, how do we pay for this?
Well, and that sounds like a lot of money, but you have to remember, in most situations, if this is a couple, we've got one person who is now had this event and they are sick and needing care, so we're expending for them, but we're also probably maintaining the family home and all the expenses that went on that side. So there can be a lot of money. You can go through your estate very, very quickly if you're paying for care.
And all those numbers I shared with you all, those are after-tax dollars, not pre-tax dollars, after-tax dollars. So it's a lot of money.
And that's the thing about long-term care insurance. The premiums may possibly be deductible for you every year. The government gives us an amount based on your age. You get to take a percentage. But then the benefits that you receive are received tax-free. So any of that money that's coming back to you for being reimbursed, you don't have to, that wouldn't be considered income. So you don't have tax there. So great on the insurance.
Then also purchasing on the premium. I know this, and our listeners may not know this, but if a corporation holds and owns the policy, the corporation can pay that, and that is tax-free as well, correct? The premium.
Right. Then you get a different amount. So that's really, really smart. If people have their own businesses in that and they can run it through their business, that's a lot better for them financially on their taxes.
Exactly. So what are some of the other resources that are out there for long-term care? I know we're talking about insurance, and we're hoping that our community has the resources, whether it be financially, privately to pay for services, or has the foresight or knowledge from our show today, or just knowledge in general to buy long-term care insurance. Assuming that they're not eligible for Medicaid, where else can we go to help people successfully age in place?
There's a lot of agencies. One of the biggest ones would probably be the Area Agency on Aging. We have a lot of resources here in our community. There's also some programs through a place called Duet. It's Partners in Caring, and they use a lot of community volunteers, kind of a neighbor-to-neighbor type program. But there's also caregiver support lines. There's so many things. I think the biggest thing is just getting to one of these major agencies and asking them, and they can do a good rundown of what things you might qualify for, what programs. I know Area Agency can do that.
You mentioned two that are near and dear to me, Duet and Area Agency on Aging. Area Agency on Aging gets their funding from the Older Americas Act out of Washington, D.C. They get funding from our state. So there are additional resources for our consumers to be able to successfully age in place by contacting them. But then you have an organization like Duet, which is 100% funded not-for-profit. It's a community that is pulled together. They have over 2,000 volunteers that will come into your home, help you shop and get your groceries, help care for you. We have grandparents that are raising grandkids, and they'll assist them with that. So there's an abundance of resources out there. You need to research those. If not, please call me at Cypress HomeCare Solutions, and I can connect you to them. And you can reach me at 602-264-8009. I'm afraid we got to take another break, and we're going to come back and finish our segment with Maryglenn Boals. This is Bob Roth, Health Futures, taking stock in you. We'll be right back.
Hi, this is Ken from Online Trading Academy Phoenix. The stock market is up over 160% since 2009. Are you? If not, why are you paying someone else to underperform the market with your money? If you're doing it yourself, isn't it time to learn to do it right, now, before the next crash? They say the best way to make a small fortune in the stock market is to start with a large one and then give it to a broker. And don't even start me on mutual funds. When you add up all the fees, they can take 70 to 80% of your profits, and all these people get paid whether you make money or not. If you're serious about making more money in the market, call Online Trading Academy at 844-8-TRADER. And register for one of our half-day classes. Learn how the markets really work. Mention Money Radio and get 2 free tickets and 4 incredible home study courses. But seating is very limited, so call 844-8-TRADER now. That's 844-887-2337 now.
Tired of paying outrageous prices for Viagra? Well, we have great news. Now you can finally get Viagra at huge discounts. Healthy Man allows you to save up to $500 on Viagra. Why pay U.S. pharmacy prices of $15 per pill or more when you can get Viagra for less than $3 a pill? Call today and get 40 Viagra pills for only $99. This could cost as much as $600 at your local pharmacy. You can't afford not to call us if you want Viagra at the lowest price. Never pay $15 a pill pharmacy prices again. Get Viagra for less than $3 a pill. Call 800-693-4711 today to save up to $500 and get 40 pills for just $99. Healthy Man is fast, easy, and affordable. Operators are waiting at 800-693-4711 to take your call now. Call 800-693-4711. That's 800-693-4711. Again, 800-693-4711.
Impatience is a virtue. Lease a new Mini Cooper Countryman for just $219 a month for 36 months or get 0.9 APR for 48 months. Visit miniusa.com for details.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Good afternoon. This is Bob Roth with Health Futures, taking stock in you, and I've got Maryglenn Boals here with me today, a long-term care expert who has your assets, protection of yourself and well-being emotionally and personally. And I want to talk to you a little bit more about the insurances that are out there, because I just was faced with a situation with my father, and it involved rate increases. And I know there are lots of challenges, especially as we discussed earlier, as this industry matures, rate increases sometimes can be somewhat inevitable because the policies aren't lapsing.
It's interesting with rate increases. It's the number one thing that people will tell you that their agent never told them. And I will guarantee you that there are 3 defined points that we have to tell you, and you have to sign that we told you. So we know we talked about it, but it's one of those things you don't want to really imagine would happen. And historically in the industry, we didn't see that. I mean, many of the carriers bragged that for 30 years we've never had a rate increase. Well, what happened in 2008? The markets, everything that the insurance carriers had their money in, they weren't getting the returns. So we have this whole pool of people that we have said, we're going to have your money and we're going to guarantee you that money and a 5% compound growth on it. We can't get that even out of our investments. Where does the money come from? They had to go back to the clients and say, we need all of you to pay a little bit more, or they would lose everything. Now, they usually give you a choice when you have a rate increase, and probably your dad had that. You can either choose to keep your premium the same usually, and they modify the benefits in some way, or you might want to take the rate increase. That's when you need to meet again with your agent and say, let's talk this through. Let's figure out, has anything changed in your life? Maybe it's been 10 years. You really can't afford the increase, or maybe it's not a hardship and it does make sense to keep it. The rate increases are always going to happen. They will continue to happen. A lot of people don't like it, but it's kind of the reality of it. I think it's a good thing to keep this contract more vibrant. It will keep you talking about it instead of you buy it and you stick it in the drawer for 20 years and nobody looks at it. Now we're thinking about it. We're maybe modifying it, changing it. I've worked with some clients who they had significant amount of money. So we reduced their policy because they said, between this and this now, we've got a lot more money than we originally had. They had another family member pass, and they inherited even more. They got to the point where they actually dropped their long-term care insurance policy because these numbers were so significant of what they had of personal means. So think of this more as a working tool. So you have to just kind of get your head around these rate increases and how to best navigate them.
Question for you. If I own a policy and I need to sit down with my financial advisor, is there a cost to doing that?
Most financial advisors, it depends on who you're working with. If they charge you for their expertise, or if it's, they maybe earn income via commissions off of products, it all depends. Now, if that's our client, we would service them for free if they'd purchase the policy through us. If they are an outside client, and we do have what we call orphans, they come to us, they don't know where their insurance agent is, or maybe their insurance agent has passed away. Different things happen.
They know they have a policy, but they're not sure where it is.
And they don't know who to talk to, so they come to us, and we do charge an hourly fee for that. We are very generous with our time, and we also, like I had mentioned earlier, we do some coaching so they will better understand. And we often encourage when people purchase, or even during those meetings, having the adult children on the phone, having them there in person so they can ask questions, because that's who's going to really have to navigate with this tool, and so that they best understand it.
That's great advice. That is absolutely great advice, because the adult children, like you said at the beginning of our show, whether it be the healthy spouse, whether it be an advisor, they're the ones that are going to be dealing with this product and figuring out how to best utilize this product to service their client or loved one. What other advice would you give our listeners with regard to long-term care insurance?
Well, I think if it's something that you're kind of pondering, or maybe that New Year's resolution was, okay, this year we're really going to talk about it. I realize it's about as much fun as root canal. It's sad to say. Because, in life insurance, they're talking about you pass away and you do really nice things for people. In long-term care insurance, you may still be very aware that you're not able to do some of these physical things or something. You may be very present, and you could see the devastation it's taking on your family, emotionally or physically, the toll of caregiving. So it's a little different conversation. But if I could give some advice, I'd say really try to find an independent agent, because what we do is we shop every carrier for you. If you're talking to someone who's with a captive agency, they're going to show you only their products first, and they may not show you some of the others. An independent kind of saves you all the running around. We usually don't care who you buy from, just we're trying to help you find the best deal. Come to us as healthy and as young as you possibly can be, because age and health drive the price on this type of insurance. So it's really important. I know everybody thinks, oh, well, isn't it 65 that I should think about this? Sadly, so many people here in America start having 1, 2, 3 chronic health conditions, and that just ticks away. Those underwriters see that, and that becomes a real concern, because you have to think that the underwriters are looking at, what is it that you have that would make you frail? So arthritis, things like that. You may
diabetes.
Diabetes is getting really tough to underwrite. So if you are a diabetic, we have to know a lot of information. And we do a lot of pre-qualifying before. We anonymously send your information to the carrier. So we can do all this, and they never know who you are. They just know you might be a 57-year-old male with this, you don't smoke, and these are your medications. Because we really want to make sure where are we going to get the best pricing, too, because your health will change that price. And I'm probably biased on this one, but I think having an insurance agent that has a bigger picture, I have seen all sides of this equation of what happens. It's so important to us that we help your family completely understand this. We help with the claims process. We help with all of that. That is just all part of our service. You know, a price is a price is a price, but it's just like in your world with home care. It's about the service.
Absolutely. You know what? This segment, this show has been incredibly resourceful for me, and I can only imagine how resourceful it's been for our listeners. And Maryglenn, it goes without saying, I definitely am going to have you back because I'm learning more. And I thought I knew a lot about long-term care insurance, and I'm learning more and more just listening and asking you these questions. So I think that, you know, you've been incredibly resourceful for all of us. And really just wrapping up our show and our program here today, I want to, be able to talk to people about this resource that you were talking about, this National Association of Insurance Commissioners. What is this?
It's the Shopper's Guide, and any of your listeners can give us a call at 602-418-5069. We'd be happy to talk to them. Or we can email them a copy of that, and they just have to reach out at MgBoals@MgBoals.com, and Boals is spelled Boals. We are happy to help them.
Maryglenn, I've enjoyed having you on the show. Like I said, I'm going to invite you back. Incredible. I've learned a great deal. I can't thank you enough. This is Bob Roth, Health Futures, taking stock in you. We've got some Alzheimer's segments that are coming up, and please listen in, 12 o'clock on Fridays from 12 to 1. And if you need to reach me, you can reach me at Bob Roth at CypressHomeCare.com or call me at 602-264-8009. Make it a great day.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 99.3 FM.
This is Mo Ansari, host of Market Wrap and president of Compact Asset Management. Join me at my next seminar on Monday, February 3rd in Scottsdale. We will review the market, discuss the top investment themes for 2014. The seminar is free, but you have to have a reservation. So call right now, 1-800-388-9700. That's 1-800-388-9700. Or you can register online at compact.com. That's COMPAK.com.